Hello friends, I'm Dr. Jayendra Yadav. I'm a consultant neurologist. I'm practicing at Panvel, Advita Neurology Clinic. My clinic is situated just opposite to a DMart in New Panvel. So today I'm going to discuss about one important investigation in neurological diseases, EEG, electroencephalography. Many of you must have heard about this term EEG, but you may not be aware about it. So what EEG means? EEG, if you have to compare it, is just like an ECG. Okay, so like in ECG, we try and detect the electrical activity heart. In EEG, we are trying to detect the electrical activity of the brain. So there are various parts of the brain, like frontal lobe, temporal lobe, occipital lobe, medial, and parietal lobe. All these brain activities can be detected by applying electrode or a scalp, and these activities can be plotted on a graph, and that graph can be recorded for like 20 minutes, 30 minutes. How does it help? While plotting this graph, we get these different activities of the different areas of the brain. So depending on the frequencies, these can be divided. They are divided into various activities like alpha activity, beta activity, theta activity, and delta activity. So a normal EEG in a person looks has a typical pattern. Okay, so any neurological affection, be it like stroke or some infection, or the commonest disease for which we do EEG is epilepsy. So epilepsy, there is change in brain's electrical activity, and so that will change the typical pattern of a normal person's EEG which we usually see. So in epileptic person, we will see a different patterns of on EEG graph which is plotted. There are different types of epilepsy. So different types of epilepsies will give a different pattern of graph on EEGs. So based on that, we can first, if we see a abnormal epileptic pattern on EEG, first it helps to confirm that what we are dealing with is epilepsy. And it's also important that we monitor over a period once person is on a treatment whether the EEG is showing an improvement. Certain other diseases, like some patients, suppose some patients have diseases like dementia, stroke, they can also change person's EEG pattern. Sometimes in ICU patients also we do EEG to detect certain disorders like non-convulsive status epileptic, where patient may not actually throwing an seizure, but EEG will help us to diagnose what that person's drowsy state is, probably because of the certain epileptic activity going on in his brain. So EEG is very important diagnostic modality. So whenever any neurologist asks for EEG, it's basically to detect whether there is abnormal electrical activity going on in the brain. Thank you.